Well, welcome and thank you for coming back. Outside of the organization, you may see what looks like a celebration that with a lot of activity by folks from the M&A and from our nursing staff. Inside this organization, we're completely focused on quality, patient safety, and the work that we do every day to make sure that our patients are safe and they receive the most compassionate care. This morning, Terry and I welcomed into this organization well over 230 nurses that are taking up the patient care left by the M&A's decision to pull our nurses out of this organization. The stories that we've heard already this morning have been great in terms of the nursing staff, the work that our entire team, our doctors, our therapists, our technicians, our social workers, everybody is on point, everyone is here, and everyone is focused completely on what we do every day, which is to take care of our patients in the most compassionate way. Last night, we had a negotiation session that obviously did not result in an agreement. We continue to make concessions as part of our contract negotiations and as part of our proposal. Unfortunately, the M&A bargaining committee didn't even look at our proposal before they decided to call the strike. That leaves this organization in a position where we have to remain focused on taking care of our patients, doing what we do every day, and that's what the team is focused on, taking care of our patients. So I'm going to have Terry Hudson-Jinks, our Chief Nursing Officer, come up and make a few comments, and we'll go from there. Terry.
Thanks, Mike. So I believe the nurses believe no one wins in a strike. And like we shared with you a couple of days ago, Dr. Wagner, myself, and the entire leadership team thought long and hard about what we could do at the table yesterday. And we did go and we made concessions. We made significant movement. We extended the pension for an additional 18 months, and we put $2.5 million back on the table. It's shocking to me that the M&A didn't even look at our proposal before walking out on us. Very disappointing. The M&A talks about the situation being a staffing issue. It's not a staffing issue. It's a pension issue. It's a money issue. How do I know that? We agreed, and actually it was our idea, to put additional ICU nurses in the contract in our final proposal, and they rejected that. That tells you it's not about staffing. It's about money and it's about the pension. So that was last night, and this is today. The M&A has made their decision, and we have made ours. We talked about this organization making a decision to run operations as though it were any day in July. We owe that to our community of Boston, and guess what? We're really glad we did. Our census today is 312. We have 60 cases booked for the OR. And guess what else? Boston Healthcare, nearly every organization is at or above capacity. We've made the right decision for our patients, the patients who depend upon us, to be here in their moment of need. And nothing will ever make us do anything different than that. So at 4:30 this morning, like Dr. Wagner said, a team of members of our community, our family, come here to work. Leaders, nurse leaders, physicians, members of our community, many people wanted to step out and help to make sure that their transition from our nursing staff to our replacement nursing staff went smoothly. And it did. Patient care is being delivered seamlessly. Patients are safe. We're extremely proud of that. Thank you.
Questions?
The Nurses Association, I'm Tina Martin from WGBH. The Nurses Association sent out a press release saying there were more than 1,000 nurses on strike, and you're saying you brought in how much replacement staff?
Right.
I'll let Terry answer that
Okay,
question.
just help me with the numbers in terms of how many you need in order to
Sure.
Okay.
Happy to do so. So several months ago, when we were realizing the pattern of the M&A throughout the Commonwealth and issuing strike notices, we decided to really take a good look at how we wanted to run operations here in the unfortunate event that we got a strike notice. And at that time, we made a staffing plan. And at that time, we made a decision to staff the organization like we do any day. So the numbers of nurses we have right now are the numbers of nurses we would have had last week. It's the same number of nurses in-house caring for patients. We do have 1,267 RNs in the M&A bargaining committee, but those 1,200 nurses aren't in here taking care of patients at one time. So we've created our model to be exactly like we've had prior. The total number of replacement nurses we've gotten is 325. Thank you.
What happens tomorrow morning at 7 o'clock when the nurses come back to work?
The nurses who, we've had some very brave nurses who came to work today. And given the intimidation that I know they felt, I've heard it and I've seen it in print myself. We're extremely proud of those nurses. Those nurses are here with us now. They're going to be working tonight, tomorrow, and through the 5-day strike. Anybody who didn't show up for work can come back to work after Monday, the 17th. We have our replacement nurses here. We got our issue of a strike notice, and we had the burden of responsibility to be prepared, and that's what we've done.
How many nurses crossed the picket line?
I believe it's 12 to date.
In terms of the pay that they want, you said that is the issue. They in their press release said that Tufts is viewed as the lowest paying hospital, that this is a training ground. People go on to other hospitals because the pay is so low compared to this. Can you respond to that?
Yeah, so when we went to the table, Dr. Wagner and myself and the team met, and we always evaluate our pay structures through every level of the organization, and we realized that we wanted to be more market competitive. And that's why our final proposal had a 10.5% raise for nurses on the top step over 40 months. That really was something we wanted to do, and we stretched ourselves to do that.
Talk about retention as well.
Yeah, so I would say that there is something we need to correct, and we've corrected in other forms of media. Our turnover rate for nurses is one of the lowest in the country. Our retention is about 96%. In fact, the statement that new nurses leave is simply not true. We have a 100% retention rate of new nurses in this organization. We're proud of that. We have a lot of systems and supports here that we've built to support our nurses in creating a community and a collaborative practice with other care team members like our physicians to encourage nurses to stay here. And there's got to be a reason that they do. 60% of our nurses are on the top step. That says something. Says something great.
Forgive me, earlier you said that these nurses would be able to come to work after Monday, but isn't it Monday morning when they return to work?
Yeah, Monday.
Okay, so it's not after Monday.
Yes,
it's
Monday morning at 7
At
a.m.
7. Okay,
Yes,
got
thank you.
it. Thank you.
Clarification.
You mentioned you had 60 operating room cases. Have any patients asked to be transferred to other hospitals or rescheduled or asked for changes?
No. No cancellations today. No requests to be transferred.
Any issues reported to DPH?
No, DPH is on site. We've got how many, Saul? 6 members of their team, and we're working collaboratively with them. We've been working with them for weeks.
Patients are raising
Just a
concerns.
second. This woman over here has had a question for a while.
Thank you. Many of the nurses outside said more than competitive wages and the pension problem. They're concerned about better staffing. Many of them feel like they're forced to work mandated overtime. They're stretched thin among their patients. Do you have a response to that concern?
Yeah, sure, absolutely. So long before we went to the table to start negotiations, we have been growing here at the medical center, and we've been adding nursing positions. We've added an additional 160 nursing positions in the last several years. So we're in a growth trajectory. I would say, going back to my earlier point, if this is a staffing issue, why would they have rejected our proposal for additional ICU nurses? It just doesn't make sense. And our quality outcomes are outstanding. We watch those closely, and they're outstanding, and they're as good, if not better, than our competitors in this town and nationally.
Are patients expressing any concerns about not having the regular nurses in the hospital?
You want
Right,
to talk
Tom.
about the comments?
Yeah, so the comment this morning was, one of the patients said, if it hadn't been for the news reports, I would have never known that there was any changeover in the nursing staff. I think that we're hearing from not only our doctors, but our patients, and even the DPH reviewers that I ran into this morning shortly after 7 a.m., that the seamless transition of care to the replacement nurses has gone extraordinarily well, and we're not having any concerns at that level. DPH is asking questions, and they are asking patients specifically, and we are in close communication with DPH throughout this entire process. So it's not just our word around this issue, but it's been something that we're feeling across the organization. I will say, the physicians and the other care team, this has been a galvanizing moment for the organization. We see healthcare as a team process. It's not just about one type of provider. This is work that requires many different providers: doctors, nurses, therapists, technicians, everyone that I mentioned earlier. And when we look at this, those members of the team that are here, other than the nursing staff that are not here because of the M&A actions, were here this morning. They were ready, and to bring into the nursing staff and make them part of the team. And what's really amazing about this organization is we do this kind of work extraordinarily well. We rise to the challenge, as we did with the Boston Marathon and the bombings and everything else that we deal with in downtown Boston. And I want to reemphasize one thing that Terry said. We have a commitment to our community of Boston, our community of referring physicians. The decision we made to run the organization as normal as possible, I think, given the circumstances of where Boston is today, in terms of hospitals being busy, was not only important for us, but it's important for the Boston community. That's a responsibility this organization has to carry forward, whether it be with the mayor, with the city councilors. Not to be able to take care of the same number of patients the way we normally do is frankly not part of who we are. And it's disappointing that the M&A would have made this choice to put the organization, in their own words, in a crippling position and try to harm us economically. It's not right economically, and it's not right for healthcare delivery.
Michael, why do you think this is happening now, this strike? We haven't had one for 30-something years.
Boston has not had one for 30 years. Bay State Franklin had one 3 weeks ago. The M&A has issued more strike notices. They took Brigham to the brink. They took us to the brink in 2011. I think that the M&A does have a specific corporate objective across Massachusetts to increase their relevancy and to use strike as a method to bring hospitals to the brink, either anticipating that a hospital can't handle a strike and the replacement requirement necessary, or two, doesn't want to handle the political pressure associated with the strike. We were willing to basically say we're not willing to be held hostage to this corporate objective of the M&A and take and plan for the replacement nursing staff necessary and the clinical work necessary to allow for seamless operations, and simultaneously, if necessary, take some political heat in the process. I would say that there is appropriate levels of concern being raised by the politicians, but I think they also understand very well the situation where healthcare is at today, the great challenges that we face, the reductions in reimbursement, the threats to the state budget that the Mass Health Program poses, and the uncertainty at the federal level. The politicians understand there is a very tough road for healthcare providers to go into the future, and that simultaneously trying to solve these problems by supporting a union approach, but also telling hospitals you have to reduce costs is just something that at some point you have to let hospitals try to manage the changing world of healthcare delivery and allow those who've been entrusted with care delivery to try to get their jobs done and do it in the most effective, compassionate, high-quality way.
You mentioned political pressure. Have you heard from the mayor or any other state?
Mayor and I have a very good working relationship. The mayor, I think, has been, I can't speak for the mayor, and I would ask if you want to talk to him directly, but the mayor has been a very good supporter of this medical center. But, this is, I think it'd be best if you talk to the mayor directly about how he feels about things. I've been keeping the mayor up to date as to where things are at. We're an important public service for the city of Boston, and I feel an obligation to keep the mayor up to date as to how things are going.
Any future negotiations planned at this time?
Right now, our complete focus is on taking care of our patients, making sure that these 5 days go without any difficulty, and again, making sure that we as an organization, because this has been traumatic for the organization, there are a lot of people here that are dismayed, disappointed that the M&A has taken this approach, and we have an obligation to make sure the community comes together, the community is cared for themselves, and we're going to be completely focused on that. So we do not plan on getting back to the negotiating table, because the people you see here are responsible for making sure this organization runs the way it's supposed to run.
Can you talk about the process for the replacement nurses to assess the need for them on a day-to-day per diem basis, or what kind of cost is that for the hospital to bring them in?
Right, so I'll let Terry answer that question.
Yeah, several months ago when we were making our plan and confirmed our plan, we reviewed census trends over the last several years and certainly in the last recent months, and made a commitment into how many nurses we would need to have here on site. So it's the same team that'll be here now through the end of the strike. The continuity of care was really important to us as well.
Do you have to pay for their travel and
Yes.
their housing?
Yes.
Do you pay them a higher wage than typically these nurses that are outside would be making?
I can't tell you what each of these nurses are making. We contract with an agency, and we outline the specific skill sets of the nurses that we need. So we're a pediatric and an adult hospital, so we outline exactly what we need and the numbers of nurses we need, and they go find it. Honestly, and we've talked about this before, this is multiple millions of dollars that we needed to commit to, given the strike vote that the M&A decided to take, the strike authorization vote, and certainly the strike notice. The dollars spending starts as soon as the M&A issues a strike notice.
What do you think it'd be like on Monday? Is it
What-
fair to even, I'm not sure we'll be hearing from you guys between now and then, and today becomes tomorrow, and that always happens.
First of all, we're gonna keep you informed along the way, so don't worry about that.
Yeah.
Well, you know, we've talked a lot to our community over the last, all during negotiations, but specifically over the last few weeks. Dr. Wagner and myself have had numerous town halls together with the care team leaders, and we've said that we will respect everybody's decision. We respect people who decided to cross over. We respect people who decided to go on strike. We know many nurses didn't want to and felt incredible intimidation by the M&A, and this organization is prepared to welcome them back. As I said, we're a family here, and many of us have worked together for decades. And we are going to do everything we can to work as a cohesive group, really focused on what we do well together, and that's awesome patient care delivery. I don't know if Dr. Wagner wants to add to that.
No,
And then we'll take, after that, we'll take one more question and.
So I agree. One of the things we've spent a fair amount of time talking about is how do we heal as an organization. In 2011, when we came to the brink of a potential strike and averted it at 2 o'clock in the morning or so, there was a lot of healing that was required. We learned a lot from that, and as we've chatted about and planned for this process, there's not only the planning that has to be done to make sure we have clinical operations as seamless as possible, but after all of this is done, whether we averted the strike last night or whether it's Monday morning, we as an organization have to come together and heal. And that means that there are going to be some hard feelings, and we need to, at the top of it, make sure that there's respect and understanding that people have to make individual decisions. Those who've, and as Terry said, made the decision to cross the line or not cross the line. It's fully our expectation that we will respect either of those decisions in an equal way. And it's our anticipation and hope that the M&A will also respect that same level of respect.
Is there anything you could have done differently? Anything you wish you had done more or differently to try to avoid the situation? Should you have talked over the weekend or anything else you could have done?
Yeah. I don't think there's any more that we could have done. We put a very generous proposal on the table in terms of compensation and in terms of the conversion of the pension plan. So from a technical perspective, there's nothing more we could have done. I will say that we do lots of negotiations. We do lots of negotiations with the federal government, with insurers, and with other organizations. And there's a certain tempo to the negotiation process. It's a bilateral process. It's one that is where there's a lot of give and take, and there's an understanding of alignment between us and that other organization. And again, as you know, we've gotten into our tussles with payers in the past, and we've come to resolution because we're aligned to ultimately objectives that are going to be to the benefit of both Tufts Medical Center and whoever we're contracting with. The difficulty here is that I'm not sure that there's that alignment because I've said this before, I believe there is a stronger corporate objective at the M&A level, and that Tufts Medical Center and our nurses have been drawn into that process at the corporate level from M&A, and that this is something that we're going to see more of across the state. So I think that that's where there's a malalignment.
Great. I'm going to let these guys quickly, and then we're really out of here.
Just to be clear, so you guys proposed tried to negotiate with them. They denied the negotiation, and now on Monday they're going to return to work like if nothing had happened, basically, and no change will be done? Or will you still increase the amount of staffing and increase the monetary?
So do you want to?
Yeah.
Yep.
We very much want to reach an agreement with the Massachusetts Nurses Association, but we haven't done that yet. So eventually we'll be back at the table and remain negotiating. We gave them a final and best offer last night with those significant enhancements. So we'll be back at the table at some point, but we can't institute or implement those changes right now. So, we're going to stay positive and hopeful. And we need to find a solution together that's good for the hospital, certainly good for the nurses, and great for patient care.